Hello, my name is Sophie Blake and I'm here with Mr. Adrian Lower, one of the UK's leading specialists in treating Asherman syndrome. I'm also one of his many patients being treated for AS. Firstly, thank you very much for being here. What is Asherman syndrome?
Asherman syndrome is a condition where the lining of the uterus adheres from the front wall to the back wall, causing either a reduction in periods or a complete absence of periods.
What causes it?
Caused by any condition which disturbs the lining of the womb, the endometrium. Typically a DNC, dilatation of curettage, where we scrape away the lining of the womb, particularly after childbirth. If it's over-aggressive, or after childbirth the endometrium is very soft, and more particularly if there's infection, the effects of adhesions and scarring inside the uterus are much more marked. Sometimes it resolves with time, but by and large, once you've got adhesions forming inside the uterus, they're there for good.
And also, the longer it's left, the worse it can get?
To most intents and purposes, yes. The longer you leave it, the more mature the adhesions become, the more difficult it is to deal with.
Is it as rare as we're led to believe?
No, I don't think it is as rare as most obstetricians and gynaecologists commonly believe. I would say that around 5% of women will experience some form of adhesions inside the uterus, either after a normal delivery or after a DNC or a retained placenta.
What percentage of women then who have infertility are those with Asherman's?
I would anticipate that we're probably seeing around 5 to 10% of patients who are attending fertility clinics will have something wrong with the lining of the womb, probably some element of Asherman syndrome, particularly if they've been pregnant before, if they've had a termination or a DNC or a previous complicated delivery.
It's quite a high percent, isn't it?
It is.